Welcome to Cancer Explained with Central Care Cancer Center. It's likely that someone you know has been diagnosed with a form of cancer. Learn more about specific cancers, their risks, signs, symptoms, and treatment options by listening to Cancer Explained.
Hello and welcome to Cancer Explained with Central Care Cancer Center. My name is Leanne Powers. I'm the Marketing Director for Central Care, and with me today is Radiation Oncologist Dr. Perez-Tamayo. At Central Care, we are dedicated to keeping expert cancer care close to home. We have state-of-the-art facilities throughout rural Kansas and in Missouri. Whether you need radiation or chemotherapy, a second opinion, access to clinical trials, financial counseling, or other supportive services for yourself or your family, even genetic screening for cancers, Central Care Cancer Center is here for you. At any time, feel free to email with any questions or comments to askdoctor@cccancer.com. That's askdoctor@cccancer.com. Our discussion today on Cancer Explained centers around cancers affecting women. Cancers like ovarian, uterine, cervical. We're going to leave out breast, as we'll do a full program on breast cancer next month for October. So let's maybe start with ovarian. I assume it starts in the ovaries or the fallopian tubes for that matter. Does it travel there?
Well, no, actually, it's its own entity. There are things that can definitely travel to the ovaries. In fact, ovarian cancer is usually the number one reason for having a cancer in the ovaries, but metastatic disease, or in other words, disease that comes from elsewhere, is not completely unheard of. In fact, often seen in two cancers specifically, and one is gastric cancer, or in other words, cancer of the stomach, and cancer of the breast. These are, for reasons that are unknown, become liquidy in the coelomic cavity, in other words, the cavity that holds your abdomen and pelvis, and they shed seeds, basically, and those seeds come down through gravity to the ovaries, and then you have implants in the ovaries of these cancers that are not from there. They are actually from elsewhere. Cancers of the ovary proper are more common. The number one cancer of the ovary is cancer that is proper of the ovary, but they're divided into many types. And I'm not going to talk about pediatric ovarian cancers because they're a completely different thing altogether, and many of these are actually highly curable. The cancer of the ovaries, the cancer of the ovary I'm going to talk about, since it is the most common of the ovary, is the generic cancer of the ovary proper, which happens in younger women, but not pediatric group as much as anyone after 30 years of age. And these, unfortunately, are silent cancers. They basically arise inside the ovary, and they start shedding seeds into the abdominal cavity early on in their progression. It is in the gynecological cancers, it is cancer of the ovary is the second most common cancer, and it is actually the fifth most common cause of cancer death. And why is that, even though it is not that common, is because they're usually found late. There's no markers. There's no surprise. Most of them are surprise. They can affect women throughout the various early and middle age women. Usually, unfortunately, they are not necessarily very old, so therefore it can impact the family unit very, very severely because they may have young children. And they're usually diagnosed at a stage 3 category, which means that they are into the abdominal cavity or into other organs in the abdomen or pelvis, and they have to be treated in a multimodality type of treatment. These, we're going to call these specifically, scientifically, epithelial ovarian cancers. They're about 85 to 90% of all the cancers of the ovary. And they can affect not only ovaries, but they can also be of the fallopian tube proper. And these, for reasons that we don't know, shed early on into their development, and that's why they spread quickly into the peritoneum, or the cavity of the pelvis and abdomen.
Can I ask you then, so ovarian cysts, is that the start of something, or no? That's something totally altogether different?
Completely different,
Okay.
although they can present as cysts. Ovarian cysts are very common. In fact, it is normal for the maturing of the ovum to become a cystic structure that bursts into the the fallopian tubes, into the tubes, and then into the uterus for the preparation of being fertilized. So cysts, due to basically endocrinological basis, are common in the ovary, and they do not necessarily cause or promote cancer. In fact, some women have something called a cystic ovarian syndrome, where they just have a lot of cysts in their ovaries, and their inability to ovulate is common. But this is not the type of situation. These cancers are of the ovary. They can present in a cyst, but usually they present as a mass. They can drain. Their drainage can be systemic, meaning in the blood. It can be through the coelomic cavity, in other words, the cavity where the gut is, or the lymphatic drainage, which means where the lymph nodes are, into the nodes or into the ligaments that hold the uterus and ovaries. The ligaments, we'll talk about these later on as we talked about other organs, are the structures that hold your womb and your ovaries and your tubes in place. And these ligaments are, if you can imagine a bat's body, if you consider it upside down, the head of the bat is the cervix, the body is the uterus, and then the legs, the wings are basically the tubes and ovaries, and the webbing of the wings are the perimeter, or the supporting structures that hold this apparatus by ligaments to the bones of the pelvis, so that you don't have a uterus that's bouncing off your pelvis. You have something that is in place.
And now I'm never going to I'm never going to forget that image of an upside down bat.
That's what it looks like.
When describing my reproductive system here.
And it's holding on tight.
Okay.
You don't want it bouncing around.
Okay. So is the symptoms, though, so like you said, it's a silent, so you never know until it's too late. So how, I guess there's really no symptoms per se, or? The
symptoms usually are because there could be many symptoms, but the usual symptom is that you for some reason, your girth, in other words, your waist becomes big for no reason. You're not necessarily gaining weight, or you may be losing weight, but your girth is growing. And this is a sign that you have ascites, or you have basically water in your abdomen caused by these seeds that are being shed by the ovary.
What about tumor markers? Is there any kind of genetic screening that you could do for ovarian cancer?
No, unfortunately not. There are markers that you can follow these, like for instance, CA-125. But some of these markers can be confused with a pregnancy. They can be confused with other things that have nothing to do with the cancer, and therefore they're not very useful as a screening tool. They're useful as a follow-up tool. And the genetics also can be very important. If you have a family of people that have breast cancer, the BRCA1s and BRCA2s, your risk of ovarian cancer is increased greatly, 40 to 50% lifetime risk of ovarian cancer, just by the mere fact that you have somebody in the family with breast cancer that is BRCA positive.
Wow. I know you mentioned that this could be even a middle-aged kind of...
It usually is kind of 30 to 60 years of age is when it hits the hardest.
Okay. And it also, your risk, I know that I had this statistic here from the American Cancer Society, of getting ovarian cancer during a lifetime is about 1 in 78. So it is still somewhat up there. Of course, it's not as like breast, but still definitely something to look for.
And that's the curious thing, Leanne. 1 in 78, but is the 5th most common cause of cancer-related death. So you can imagine being there way down there, close to the 100 mark, yet it is up in the first 5 positions of causative agents for cancer.
As always, you can email questions, askdoctor@cccancer.com. Again, I'm with radiation oncologist and president of Central Care, Dr. Perez-Tamayo, and we've been talking about cancers that affect mainly women. And doctor, one cancer that may not be as common as others that affect women is uterine cancer, but I think it's also called endometrial cancer, essentially, right?
That's right. And Leanne, this is a cancer that is most interesting to me. I was privileged to be asked to participate in writing Advances in Gynecological Oncology, which is a 5-volume textbook. And my part was endometrial cancer. So this is an area that I'm particularly well versed in and have written on it extensively. It is a common cancer. In fact, it is probably the most common cancer, gynecologically speaking, in most of the developed countries. And it is a cancer that can be promoted, let's say, or amplified by estrogens. Now, estrogens can be exogenous, meaning from the outside, or from the inside. So exogenous estrogens that can not cause it, but have it basically promoted, are things like direct estrogen that is not opposed, or eating a lot of foods that have estrogen in them, like, for instance, milk that is particularly high in estrogens, that the cattle have extra estrogen because they're being forced to produce more milk for commercial purposes. Some of the meats have estrogen in them to make them marbleized or fat. So this, when you ingest it, and you ingest it daily, can basically ride your receptors in your womb very, very fast, more than they're ready. They're being basically stimulated, overstimulated. But there's also inside estrogens, which are caused by fat, that can also make your cancer of the uterus become a reality. So women that have a higher weight are more likely to have cancer of the womb. But again, please note this, that even though this is the most common cause of cancer, when gotten early, it is almost 100% curable. Again, early is the key word.
Is the treatment for it considered, chemo, radiation, and surgery?
No, that's why it's so nice. If you have it early, surgery is mostly enough. It is when it becomes endometrial cancer. Endometrial means inside the muscle. The myometrium is the muscle of the womb. So the endo is the actual covering inside, which causes your period. So these glands inside the muscle of the uterus has to be a muscle, because when you grow a baby, you're pushing it out with the muscle of your womb. That's what gives you the cramps and the pain. Well, the lining of the uterus is what gives you the period, or the blood that basically forms the initial attachment of the ovary that is fertilized and feeds the baby initially. So when it becomes overstimulated, it then becomes abnormal. And bleeding is the most common symptom that you have with this cancer. And it's usually when women are already menopausal. This is a cancer of older women that are 55 to 85. So at that point, when you're postmenopausal and you're having an abnormal discharge, bleeding or rusty or anything like this, it is almost always cancer of the endometrium. So if you go to your doctor and they do a scraping, because a pap smear, again, ladies, please listen to me, a pap smear will not detect this. You need to have a biopsy. And the biopsy then detects this. Surgery, when it's within the lining, is more than enough. So then that's it. Your chances of cure are 100% if you get it at that point.
Is your risk lowered if you have like a hysterectomy or anything?
Of course, if you have a hysterectomy, then you will never have this.
That's true.
So no, but unfortunately, cancer of the ovary, if you have ovaries removed for, let's say, with the hysterectomy that you had many years ago, you can still have cancer of the ovary even without ovaries. But you cannot have cancer of the womb without the womb. But cancer of the ovaries, yes.
If you had breast or ovarian cancer, then does that increase your risk?
Yes, it does. There are definitely some instabilities in the mutational propensity, and you can have some risks due to a genetic predisposition, but it is not as common as ovarian cancer, for instance, and definitely not in cervical cancer. So the reality is that taking all stages, if most women are diagnosed early, because it is something that you see almost immediately. You have a discharge. Women are trained to notice that their underwear are stained. We notice this. It's part of our training since we have periods. And there are the risk factors of being overweight, having estrogens that are unopposed, having no children, early periods for those ladies that have had their period at 9 years of age, or at 10 years of age, like some women do, late menopause, and then other genetic considerations like Lynch syndrome. You can have cancer of the womb, people that have colon cancer, but that's not a very big part of this.
You just caught me off guard there when you said even women who have not had a child, their risk is even a little bit higher. Is
Yes.
that right?
Yeah, that is right. Women that do not have children have a higher risk of cancer of the womb, not of the necessarily of the ovaries or of the cervix, but of the womb proper. Again, highly curable, and if we see it, see the bleeding, go to the doctor. It's easy to diagnose, easy to take care of. And the staging of this is usually based on how much of the invasion has occurred. For instance, if this is only involving the covering, that endometrial covering inside, then it's early. If it's just involving a very little bit of the muscle, because it starts getting into the muscle, it's early. Then when it goes beyond half of the muscle, or it goes down into the cervix. Now the cervix, imagine the uterus being a balloon, and where you are inflating the balloon is your cervix. If it goes down that tube where you inflate it, then it becomes a stage 2. If it goes into the tubes or ovaries or outside the uterus, it becomes a stage 3 if it goes into lymph nodes, and then it becomes almost incurable. This is one of those cancers where chemotherapy is not necessarily very effective, and we don't have a lot of choices. We do treat patients with external radiation if they have a higher risk of having cancer outside the womb, and we give it after surgery. We may have to treat the vagina or the cuff of the vagina if there is a risk there, and make it so that you don't ever see this again. But if it goes beyond that, if you have metastatic disease or disease that has now seeded your pelvis or your abdomen, your chances of cure are very small.
I'm Leanne Powers with Dr. Perez-Tamayo from Central Care Cancer Center, and we've been talking about cancers that typically affect women only, and that also now goes for cervical cancer. And first off, cervical cancer is a preventable cancer if caught early during screening. Those precancer cells can be treated, keeping it from turning into cervical cancer. And so, doctor, why don't you explain the importance of having that complete pelvic exam? Why is it so important?
Thank you very much. Well, actually, I'm going to go one step even further back. Okay. It is preventable in all ways by actually vaccination. If you vaccinate your children, the chances that they're going to have cancer of the cervix is almost remote. And why is that? Is that 99% of the cancers of the cervix, vulva, and now even head neck cancers are due to the human papillomavirus, HPV. So if you can vaccinate your child against this, then the chances that they're going to have this is remote. There are some HPV variants which are almost uniformly going to form cancers, and some that are going to give you a higher incidence. But if you have cancer of the cervix, it still can be easily curable by screening and making sure that you get it early. Now, like cancer of the womb, early treatment is your best bet because it is less complicated. This is the only thing that the pap smear does detect, and that is cancer of the cervix. Cervical cancer is the very bottom of your uterus. So again, if you think of the balloon and where you inflate the balloon, it is that bottom roll there that is cancer of the cervix. Only the roll, not the actual neck of the balloon. That's part of the uterus. The endocervix is called. The cervix is just that rolled up part at the very beginning. And it is this that the pap smear actually detects. If there is abnormal cells, dysplasia for instance, you will then be eligible to have a simple surgery and get the uterus out of there with the cervix and then never see this again. If you are still in the, since this happens actually in young women as young as 15 and 16, and usually it is not that young. Usually we're talking about women in their 20s to 60 years of age, and you still want to have children. There are things that can be done when it's early and not remove your uterus. And that can be very tricky because when they remove parts of that portion of your body, you can have what we call an incompetent cervix, meaning that the uterus and that area is open so that if you are conceiving, the child can have miscarriages because that area is open. But there's things that can be done to secure this area before you have a miscarriage. And so you can work with your gynecologist if you're interested in having children and you have that risk or you have had a positive pap smear. This is a very common cancer. It is the third most common gynecological cancer in the United States. The uterus is number one. It is quite common. Your risk rises depending on the number of partners you have. If you've never had a partner, if you're a virgin, the chances of having cancer of the cervix is 0. If you have had one partner, but your partner has had other partners, you basically have inherited any kind of human papillomavirus that has been in your partner. So even if you have never had any partner but one, you still are unfortunately at risk of cancer of the cervix due to the partners that your partner has had. Now, if your partner has been a virgin as well and you're a virgin, your chances of having cancer of the cervix is 0.
Now, do you have to have sex in order for the virus to spread?
Yes, it is a sexual transmitted disease. Okay. It is not something. Now, is it true that you can have it? Sex in these days is there's many definitions of what that is. But wherever there is a lining, meaning the lining of the cervix is not the same as your skin, or the lining of the vulva, or the lining of your oral cavity, or the lining of your anus, or even the esophagus, or even the bladder, any lining which is not your skin, can be exposed to human papillomavirus and cause cancer. In fact, I have seen it even in between the finger and the nail. That is a lining. What makes your nail is a lining, and that can have cancer due to human papillomavirus. So in the cancer of the cervix, the treatment, if it's early, can be just surgery and nothing else. But if it becomes a little bit bigger, and the symptoms are sometimes hard to detect because it could be bleeding, but you are young usually when you have this cancer and you're having your period, so you think, well, maybe it's just my period, not necessarily being in sync. But painful sexual intercourse we call it dyspareunia, is also a reason for that we should look into having it seen. The fact that you may have interperiod spotting, and definitely now as a later type of symptom would be pelvic or back pain. Then, of course, swelling of your legs can also be a reason for having this cancer. If you have a cancer like this, the HPV, the viral types that usually cause these cancers are 16, 18, 31, and 33, and these are the ones, the quadrivalent vaccinations cover these, which are about 80% of all the cancers of the cervix of this type of virus. People that have special conditions, like for instance, if you've had a renal transplant, or you have, or you're a smoker, or you've had many, many children, or you've had sex at an early age, multiple partners, all of these give you a higher risk for having cancer of the cervix.
So it's so important to get that screening done, your pap test, your rectal exam as well, and at least an HPV test too, correct?
Well, there's no HPV test, but there is a test that can tell you if you have HPV, which most women that are sexually active will have HPV. So that doesn't mean that you have the HPV that will have cancer. So they do the phenotypes, the viral types, where they can classify whether your HPV is one of those that will form cancer. You can have a test that will give you an idea. In fact, you don't even have to have a test. There's something called coilocytosis on your pap smear, which shows that you've been exposed to a virus. The virus may not be necessarily the type that makes cancer, but it is a human papillomavirus, which is a virus that has been around for a long time, and it is seen in humans.
It would never transfer into like one that causes cancer, though.
No.
If you had, okay, so once you got something like that, then you just have it.
If forever.
Yeah.
Yes. No, it's definitely, and it causes something called dysplasia. So if you get a copy of your pap smear and it says dysplasia with a Y, DY, you should be worried that something is causing the cells of the lining of your cervix to become angry, to be dividing abnormally.
Doctor, it feels like women can never catch a break here. I mean, as far as, once you reach menopause, even there's always going to be something that we need to make sure we're getting screened for, or just recognizing. It's like we never can really take a vacation, it feels like.
Well, no, that is very true. And as we get into more of the COVID and more of the things that we're seeing these days, everybody has to be vigilant about their health, because it's really your responsibility. Yes, some people feel, gosh, I've gone to the doctor. Why did they not detect this? Well, you are really the leader of the team. And if you don't guide the doctor to say, look, I've been having this and this symptom, or this hurts me, or this is even if it sounds like it's not an important piece of the puzzle, you should always say it, because it could make that person get a test that may detect something that is important to be detected early.
We also want to mention that in Kansas, there is the Early Detection Works program, and essentially it helps women get breast and cervical cancer screenings for free here in Kansas, depending on if you qualify. And the enrollment takes anywhere from 5 to 10 minutes, and we've got a toll-free number we want to give you, so you can call and just see if you qualify. And the screening services, then they would direct you to a clinic that will offer the screening, whether it's a mammogram, a pelvic test, even the pap test, and the breast exam as well. 1-877-277-1368 is the toll-free number. 1-877-277-1368. And again, this is the Early Detection Works program here for the state of Kansas.
I want to highlight, Leanne, that this is very tricky thing, a little detail that you need to understand, that if you have an abnormality, be it breast abnormality or a pelvic exam, this early detection program is exactly what it says, detection. So if you get a biopsy of anything that is abnormal, then you're disqualified to participate in this program. So if you have a mass that is palpable in your breast and you get a biopsy or a mammogram that's abnormal, you are no longer going to be eligible for this screening program. So please make sure that you are enrolled before any biopsies are done, and then it will cover you.
Ultimately, to talk to your healthcare provider, and they can provide you more information with this too. Did you have anything else you wanted to add, Doctor?
No, I think that, as I said, we are the captains of our own ship, and we certainly can make an impact by telling our providers things that bother us so we can then pursue it. And if you don't get satisfaction, go elsewhere or get a second opinion.
That's so important. Thank you so much, Dr. Perez-Tamayo. Well, we appreciate you taking the time to listen to Cancer Explained with Central Care Cancer Center. With facilities throughout rural Kansas and in Missouri, Central Care offers complete cancer care all under one roof, so there's no need to travel far for the best in care. Whether you need radiation or chemotherapy, access to clinical trials, financial counseling, or supportive services for yourself or your family, maybe you just need a second opinion, Central Care is here for you. Bringing expert care to you is an important component in the success of your outcome. And being surrounded by your family and your friends, that can be the factor that elevates your treatment. Feel free to reach out by calling 800-592-5110 or visit us online at cccancer.com. You can always send an email to askdoctor@cccancer.com. For Dr. Perez-Tamayo and all of our amazing providers and nurses, I'm Leanne Powers. Thank you for listening to Cancer Explained with Central Care Cancer Center.
You've been listening to Cancer Explained with Central Care Cancer Center. Offering expert cancer care that's close to home, Central Care Cancer Center has clinics throughout Kansas and in Missouri. Central Care Cancer Center. Online, cccancer.com.